Welcome. Today, we're diving deep into autoimmune myocarditis, a complex and often challenging condition affecting the heart. This isn't your everyday heart problem, it's a battle where your own immune system mistakenly attacks the heart muscle. We'll explore what causes this, how it damages the heart, how it's diagnosed and treated, and what the future holds for people living with this condition. So, let's get started! The exact cause of autoimmune myocarditis is often difficult to pinpoint, but it usually arises after a trigger that sets off the immune system. Viral infections are the most common culprit, with viruses like Coxsackie virus B and adenovirus frequently implicated. In some cases, bacterial or parasitic infections can also play a role. Certain drugs, like some chemotherapy agents and environmental toxins, may also contribute. But here's the crucial part in autoimmune myocarditis: the immune system, while initially fighting the infection, becomes misdirected and starts targeting proteins within the heart muscle itself. The pathophysiology of autoimmune myocarditis is a cascade of events triggered by the misguided immune response. It begins with the initial heart muscle damage, often from the infection itself. This damage releases cardiac proteins into the bloodstream. The immune system, now primed by the infection, mistakes these proteins as foreign invaders. This triggers an inflammatory response within the heart, with immune cells like T cells and antibodies attacking the heart muscle cells or myocytes. This ongoing inflammation weakens the heart muscle, leading to impaired heart function. Over time, this can cause scarring or fibrosis of the heart tissue, further hindering its ability to pump effectively, ultimately leading to heart failure or arrhythmias. Epidemiological data on autoimmune myocarditis is limited, as the condition often goes undiagnosed or misdiagnosed. It's estimated that myocarditis, in general, affects anywhere from 1 to 10 people per 100,000 annually, and a significant proportion of these cases have an autoimmune component. It can affect individuals of all ages, but it tends to be more prevalent in younger adults and adolescents. There are some studies suggesting a slight male predominance, but more research is needed to understand the true scope and distribution of this disease. The signs and symptoms of autoimmune myocarditis can vary widely, ranging from mild and almost unnoticeable to severe and life-threatening. Many people initially experience flu-like symptoms, such as fatigue, fever, and body aches. As the inflammation progresses, chest pain, often described as sharp or stabbing, is common. Shortness of breath, especially with exertion or when lying down, is another frequent complaint. Palpitations, or a feeling of a racing or irregular heartbeat, can also occur. In severe cases, symptoms of heart failure, such as swelling in the legs and ankles and persistent fatigue, may develop. Sometimes, the first sign can be sudden cardiac arrest. Diagnosing autoimmune myocarditis can be challenging, as its symptoms can mimic other heart conditions. The diagnostic process typically involves a combination of tests. An electrocardiogram, or ECG, can detect abnormal heart rhythms. Blood tests are crucial to look for elevated cardiac enzymes, such as troponin, which indicate heart muscle damage. An echocardiogram, or ultrasound of the heart, can assess heart function and identify structural abnormalities. However, the gold standard for diagnosing myocarditis is an endomyocardial biopsy, where a small sample of heart tissue is taken and examined under a microscope for signs of inflammation and damage. Cardiac MRI can also be used to identify inflammation and scarring in the heart, guiding biopsy and treatment strategies. While autoimmune myocarditis isn't strictly classified into distinct types like some other autoimmune diseases, it is often categorized based on the underlying cause or the specific immune mechanisms involved. For example, it might be classified as post-viral myocarditis if it follows a viral infection, or drug-induced myocarditis if it's linked to a medication. Some cases may involve specific autoantibodies that target heart proteins. Understanding these nuances can help tailor treatment strategies. The treatment and management of autoimmune myocarditis aim to reduce inflammation, support heart function, and prevent complications. Medications often include corticosteroids and other immunosuppressants to dampen the immune response. Standard heart failure medications, such as ACE inhibitors, beta blockers, and diuretics, are used to manage symptoms and improve heart function. In severe cases, mechanical circulatory support, such as a ventricular assist device may be necessary. Lifestyle modifications, such as a low-sodium diet, regular exercise, and avoiding alcohol and tobacco, are also important. Cardiac rehabilitation programs can help improve heart health and quality of life. Unfortunately, there's no proven way to completely prevent autoimmune myocarditis. However, certain measures can help reduce the risk. Practicing good hygiene, such as frequent hand washing, can help prevent viral infections that may trigger the condition. Avoiding exposure to known cardiotoxins, such as certain drugs and environmental pollutants, is also advisable. Timely vaccination against common viral infections, like the flu and COVID-19, can also play a role. If you experience symptoms of a heart problem after a viral illness, it's crucial to seek prompt medical attention. The prognosis of autoimmune myocarditis varies widely, depending on the severity of the condition and the individual's response to treatment. Some people recover completely, while others experience chronic heart problems, such as heart failure or arrhythmias. Recent research has focused on identifying specific immune markers that can predict the course of the disease and guide treatment decisions. Clinical trials are exploring the use of novel immunomodulatory therapies to better control the autoimmune response. Stem cell therapy is another promising area of research, with the potential to repair damaged heart tissue and improve heart function. As research progresses, we're hopeful that we can develop more effective treatments and improve the lives of people living with autoimmune myocarditis.